So when I was 35 years old, I had a career in contemporary art. I was directing a contemporary art center. Everything was sort of moving in this direction that I thought it was going to move in since I was 16 years old. And I was diagnosed with cancer completely out of the blue, completely unprepared, and in a way that was extremely alienating, isolating, and also terrifying. And I decided at that point that I wanted to do something. The art world was very fulfilling in one way, but I didn't feel as if it was making as big an impact as I could have. And I wanted to take the experiences that I had as a young adult cancer survivor and turn those into some kind of action. And fortunately, at this point, it coincided with the rise of the advocacy movement, particularly breast cancer advocacy movement. So I was living in Los Angeles when I was diagnosed. I took myself back to New York, where a lot of my family was and where I felt the most comfortable, and started thinking about the best ways that I could do advocacy. And for me, having been in contemporary art, the best ways were to tell stories and to connect with people, and to help people understand that they weren't alone and that they could make connections across different kinds of groups of people, different stakeholders, and that our voices really needed to come to the forefront. So this happened about a year after my diagnosis, and I was really kind of flailing around trying to figure out what I could do which would marry all of the different kind of paths of my life. And I was given this opportunity, sort of a year out at that point, seemed to be a slightly safe, it was tentative, but it was safe, to start thinking about the future and to start thinking about what I would do. And I just so coincidentally, I was given this opportunity to become editor-in-chief of a magazine that was about to launch. And I remember sitting at my desk the first couple of weeks thinking, what in the world am I going to do? I don't know what to do. I don't know what it means to be an advocate. I don't know how to edit a magazine, although I know how to edit art publications. And then I realized that the way I would learn is by talking to people. You often think that you kind of go on this trajectory that keeps on going up and up and up, but really it actually goes like this and up and down. And having had too many encounters with the medical community, particularly over the past few years with breast cancer and then endometrial cancer, I know that at times I was really good at it for myself, and at times I was really, I really had no idea what to do. I think you have to look for where there are connections and where there are common experiences. What informed my advocacy from the history was very much some of the early advocacy in the women's health movement and the disability rights movement, which also then informed the AIDS activists, which in turn informed breast cancer advocates. So one of the most powerful things that I think came out of the disability rights movement is this commitment to nothing about me without me. And I think that is the hallmark of all advocacy, is that it is about you, and nothing can happen without you in the center. Now, you can be an expanding concept. It can be you as an individual. It can be you as a community. It can be you as your family. But nothing can happen without you. And I thought that was a really, really important, a very, very important lesson to learn.